All right, welcome everyone to today's webinar. Today we'll be discussing how to transform case notes into writing. So we are going to learn how we can easily transform case notes into writing. Let's see, we are going to use case notes for nurses today. So this is the case notes we are going to use today for today's um, tutorial. So to actually understand or to actually transform your case notes into readable writing, you should be able to understand what the tasks we are given and then the appropriate information that you are meant to add to your writing. Now, as I've told you, if you've been following my tutorials on how to use your 5 minutes. In the exam, you will be given 45 minutes. You'll be given 45 minutes. The first 5 minutes will be the reading time, while 40 minutes will be for writing. During the reading time, you're not expected to write anything or to jot anything. You are just expected to go through your writing task. So how you maximize this reading time is actually very crucial. So as I've told you before, when this case note is given to you, what you are supposed to do is not to start from the beginning of the go to the writing task. Now this is the writing task. From the writing task, the information says using the information given in the case notes, write a letter of referral to emergency consultant on duty requesting urgent assessment and management. Address the letter to emergency consultant on duty, Reddington Hospital, 11 Greyville Road, Melbourne. So you from this case notes now, if I may ask Nurse Naki, from this case note, what type of letter are we writing? Hello? All right, Patricia, what type of note do you think we are writing? We are writing a referral letter. And what type of referral letter? A code referral letter, imagine urgent referral letter. So we are writing an urgent referral letter. And for you to know an urgent referral letter, sometimes the code will be given to you just like this in the plan. They say urgent, um, urgent, write to urgent nearest for urgent nearest hospital transfer. Write referral letter to emergency room or emergency department. So when you hear any letter going to emergency, the letter is a referral letter or an urgent letter. Now, what are we managing this patient for? That's another thing you are going. What have we done for this patient so far, or what are we treating this patient for? So you now go ahead and look out for that. Usually, you can find it here just a little bit above the writing task. Here from the assessment, no improvement, query relapse of pericarditis. So that means most likely this patient had pericarditis before, and the pericarditis has relapsed, and now the patient needs to be urgently transferred to emergency room for treatment. Now that you've gotten this now that you've gotten all this information, the next thing you are now going to do is to start selecting appropriate information. Now, from the beginning of this, you now go back to the beginning of the writing task. From the beginning of the writing task, we always choose the patient's name. We'll also add the date of birth. These information are always very important. The address of this patient. Remember, we are writing this patient to emergency consultant on duty. The consultant on duty at emergency, and we are suspecting that this patient might have a relapse of pericarditis. Now, all right, as I was asking, will the address of this patient be relevant?
It's not relevant.
No, it's not relevant.
The address is not relevant. From the social background, this information, retired clerical worker, we are referring to an emergency doctor. This information, do you think will be relevant or irrelevant? One person at a time. Let me ask Biodun, what do you think? Biodun.
Hello.
Yes, is it relevant or irrelevant? Let us know.
Hello. It's not relevant.
It's not relevant, okay. So we'll exclude it. This information is not relevant. Patient lives alone. Is this information, is it relevant?
It's relevant.
Okay, Patricia, do you agree with that?
It's not relevant.
This information is not relevant. We are writing to consultants in emergency. We are not writing to a social worker or a psychiatrist. So this information is irrelevant. So ignore it. Husband died of stroke 6 years ago. Is this information relevant? Michael, what do you think? Michael is not there. Ebomosi, what do you think? All these people that are not active in this group.
It's not relevant.
Okay, Michael said
it's not relevant.
It's not relevant. Biodu, do you agree with Michael?
Yes, I agree. It's not relevant.
It's not relevant. Patricia, what's your take?
I agree, it's not relevant.
I will also agree with you guys. It's not relevant. No children. Is that relevant? Definitely not. Smoking, no, not relevant. Drinking on occasion. So all this information here, they are not, even this retired clerical. Let me be highlighting those that are relevant. Let me be highlighting only those that are relevant. So let me remove the highlights of this one. So let's go to the medical history, the past medical history, or let's say medical history, because most of them are chronic illnesses. So we go to the medical history. This patient was diagnosed of hypertension in 2012, and the patient is well managed. Naki, what do you think? Please, let's be fast in our response. Biodu, what do you think?
It's not relevant because it was well managed and it has gone since 5 years ago. This is 2020. It's not relevant.
Hypertension, is it treatable?
It's relevant. It's relevant. Hypertension is relevant because it's having pericarditis.
Okay, but you were saying
DME, I don't think it's relevant.
Type 2 DME, you don't think it's relevant?
The hypertension is relevant. Okay. I don't think it's relevant to me.
Which one do you think is relevant? Which one do you think is not relevant?
Hypertension is relevant.
Okay.
It's relevant.
Okay.
But DM is not relevant. But I think we can still add it if he's still on drugs. If the patient is still on that drug, so that they will know the drug he's taking presently.
It's okay. Let's hear from
the drugs.
Let's hear from Patricia. Patricia, what do you think?
Hypertension is very relevant.
What about diabetes?
I don't think it's relevant here.
Okay, I will surprise both of you. Both hypertension and diabetes, both of them are relevant. Most times they even go hand in hand. You can have, anytime you're having whenever you're having heart issues, most times it's hypertension and diabetes that are culprits. So this hypertension is relevant, diabetes is relevant in this case. Depression What do you think?
Please come again. You said hypertension is
Hypertension is relevant. Type 2 diabetes is relevant. This patient, remember our diagnosis. This patient is having pericarditis, inflammation of the covering.
Pericardium.
Yes, of the pericardium, the coverings of the heart. So this patient is having that inflammation. Do you get? Now, hypertension, pericarditis can be caused by infection, can be caused by trauma, can be caused by many other things. But because it's something that deals with heart here, so that's why we are, because whenever you are diabetic, you are hypertensive, you are at risk of heart diseases. So we'll add two of them. But this depression, I want to hear from Michael. What do you think about depression? Is this
It's not relevant. It's not relevant.
good? Depression is not relevant. So let me highlight the one that will say these two, they are relevant. So we'll highlight them. Good. Good. So this is not relevant. Now let's go to the medications. All these medications listed here, these first two for hypertension, the third for diabetes, the fourth for depression. Which one do you think is relevant?
Since they are still on it, they are all relevant. Since she's still on it, they are all relevant to mention them. But since it's for it.
It's okay. Patricia, what do you think?
The first three are relevant. Citalopram is not really relevant because it's for the depression.
Okay,
and it doesn't really have any contraindication with heart conditions or anything, so I would omit it.
Okay, that's nice. So I'll go with him. So you are very correct. The ramipril, because we've mentioned this hypertension, the diabetes, the drugs you are using to manage them. So it's also it will not make sense for us to say the drugs we are using to manage this condition. Because if you look at this condition, this patient have managed this condition very well. That means the hypertension and diabetes, they are well controlled. Well managed does not mean they've treated this stuff. You cannot treat hypertension, you cannot treat diabetes, but you can manage them, you can control them with these drugs because they are chronic illnesses. So let's go to the family history. From the family history, mother is hypertensive and diabetic, while sister is diabetic. So what do you guys think?
Very relevant.
Okay, Patricia said very relevant.
Yes, I agree with her. I agree with her.
Very relevant. So, well, to be honest, this information, they are neither here nor there. I don't think they are very relevant as people are claiming. Do you understand? We are not, this patient is not at risk of, we've already established that this patient is hypertensive. We've already established that this patient is diabetic. We are not suspecting this patient of having hypertension or diabetics that will now be thinking, okay, because the mother and the sister, they have this condition, most likely these patients might be at risk. So we'll not say they are relevant. But in this case, this patient is already established hypertensive and diabetic. So this information to me is not absolutely relevant. So let me just put a question mark. So you can add it, you can decide to ignore it. But in this letter, I'll actually ignore this information. But let me just mark it. Okay, go on.
Chief.
Go on.
If it was MI,
yeah,
the family history of MI.
Good. If it's a family history, let's say family history of myocardial infarction or family history of let's say MI, angina, stroke, and all. So we can add all these ones. But to me, this information, these details, they are not really relevant. So let's continue.
Okay.
Are we together? Yes. So let's go on. Let's go to the treatment records of this patient. Remember from the beginning, your role as the patient, you shouldn't forget this. You are a nurse conducting a routine home care follow-up for Miss Nancy Jones after her discharge. So you've managed this patient, they sent you to go and conduct a home visit, like a follow-up for the patient. So you should also bear your own role in mind as we are going through the case notes. Now let's go. This patient visited the first time, okay, and the patient was admitted. So these are not visits anyway. These are, I think, this is the first visit, and this patient was diagnosed. Okay, was discharged on the 8th, and then let's just scroll down a little and see. Okay, the home visit was done on the 15th. That's today. So let's go back. So this patient presented on the 6th of September this year and complained of a sharp and pleuritic chest pain that started 2 hours ago, short breathing, rapid heartbeat, general body weakness and flaring fainting spells. And patient was admitted for observation. Now let me ask again. Nurse Biodun.
Maybe we should remove admitted for observation.
Okay, so good.
Admitted for observation should not be there.
Should not be there. So this, but other ones will add them. So admitted for observation. No, we can even say admitted, but we can just ignore observation. Okay. So the next day, the patient was assessed, and these were our findings from the examination. Nurse Patricia, what do you think from this our finding? Are we removing anything? Are we do you think we should remove anything?
The chest X-ray was clear, so I don't think it's important.
Okay. So, but every other thing will include them, right?
Yes.
Okay, I agree with you. So the chest X-ray will ignore this. It's not really relevant. So we'll ignore that and include every other thing here. The treatment. What do you think, Michael?
The treatment, everything should be included.
Both the dose, the everything?
No, we can remove the dose. We just state what was given without the dose.
Okay. What about,
like
you
normal
know?
saline.
Okay.
We are writing to an expert. So he knows the dosage of, we can say normal saline was given, then diclofenac, IV diclofenac.
It's okay. I can go with you that way. Is there any better way that we can also write this, Biodun?
Please, regarding what he said, sometimes I still feel the dosage should be written because maybe the previous I don't know, this previous hospital or clinic made a mistake which he would need to correct. Maybe they gave excess fluid or something. I don't know. That's just what I'm thinking.
And the person will not correct. Oh, okay. Now let's see move forward.
Like maybe give something to like.
Go on, Patricia.
Go on, Patricia. The patient on normal saline.
Okay, so that's what I'm thinking. It could be that the previous hospital gave maybe excess fluid or maybe an extra dose of diclofenac, and they need to give like an antidote or something along the line. I don't know. That's just my thoughts. I don't know.
Okay, but if you go a little bit further, you will see that this patient's symptoms subsided, discharged home on TAPS this. So if they made any mistake, do you think this patient will be discharged home?
No, I'm just talking generally when it comes to dosages and.
Well, most times, to be honest with you, all those dosages, when it comes to writing, especially to a doctor, they are irrelevant. So here now, this patient was actually treated. If I'm even writing this, I will not even be saying patient was placed on normal saline this, that. I will just say patient was resuscitated and was given analgesics or was given IV diclofenac. Do you understand? So all this writing IV normal saline 1 liter starts, then 500 mils 6 hourly, they are irrelevant stories. Okay. So what I will do now, let me just highlight this, because even if I'm adding it this way or paraphrasing it, I won't write all these dosages. Okay, as at that time, we'll diagnose that this patient had, based on what we, from our assessment, this patient had viral pericarditis. So that was our diagnosis. And then 2 days after, that's from 6 to 8, that's like 2 days after, the patient's symptoms subsided and the patient was discharged these drugs. So we can add all this information. Patient was driven. What do you think, Michael, about the third line? Patient driven home with hospital ambulance.
That one, I don't think it should be added.
Biodo, what do you think?
It is irrelevant. The only two things that are relevant here is, the only thing that is relevant there is discharge home on drug.
Okay.
Discharge home on drug.
What about symptoms subsided? Is it not relevant?
Yes, it's relevant.
Okay, yes, it's relevant. It's relevant.
Okay. These two are relevant. As the patient symptoms subsided and the patient was not discharged. Please always mute your mic when you are done talking. Okay. This information, look at patient symptoms subsided and then was discharged home. This information, they are irrelevant. On TAPS, ibuprofen, they are relevant. So let's continue. So we ignore them. The patient was driven home with hospital ambulance. Unnecessary stories. You can't be telling somebody at emergency all those stories. They are irrelevant. Sister visited to stay with patients. What business does the consultant at emergency have with this type of story? So it's actually irrelevant. Follow-up visits arranged on this date. That one you can add, you can decide to ignore it. Then let's now come to the home visit that was made. So patient was visited, patient not happy, feeling chest pain, shortness of breath, generalized weakness, palpitations, blood sugar readings within normal ranges, sister no longer staying with vitals, no longer staying with her, vital signs, all this, no assessment, no improvement, query, relapse of pericarditis. Patricia, which information am I removing and which one should I add?
Takes routine medication regularly, blood sugar readings within normal ranges, sister no longer staying with her. Then for the vitals, the BP is within normal range, so it's not relevant. So those ones I mentioned are not relevant, but the other ones are.
I'm confused. Just mention the ones that are relevant. Let me start highlighting them from the beginning.
The ones that are relevant,
okay.
The observations on the day of the visit, patient not happy, feeling chest pain, and all that, all those ones. Then the vitals, the temperature, respiration, and the heart rate.
Okay. Okay. Then your assessment, right?
The assessment.
Okay. Now we are done. We are done with selecting our information. The next thing we have to do now is to organize this information into, to organize them the way we are going to write them, which will be our paragraph 1, paragraph 2, paragraph 3, paragraph 4, paragraph. So any number of paragraphs that you will have, which one and which one should be our first and second paragraph. So what will be in our paragraph 1, Michael?
It's emergency. So today will be the today's visit will be in paragraph 1.
Patricia, do you agree with him?
Yes, I agree.
Our paragraph 1.
Oh
No,
no,
the
sorry.
Paragraph 1, sorry.
The reason for the urgent referral.
Yes.
Okay. Our paragraph 1 should be what? That's what I want to know.
The reason for the urgent referral and what the patient was being
What was
managed.
done for the patient and the
What's
reason for the
what's that
referral.
paragraph called?
Introduction.
So our paragraph 1 should be the introduction, right?
Yes.
So what will paragraph 2 in this case now be?
The paragraph 2 will be
No, Biodun, what will paragraph 2
the
be?
home visit done on the home visit done on the 15th, the last home visit.
On the, if you are saying on the 15th, you say today, let's use today because 15 is
Today, yes.
the day you are writing. The day you are writing exam is usually the last visit or whatever. And from
Okay,
this case,
yes, that's on the 15th, yes.
So everything done today should be the second paragraph.
Yes.
Patricia, do you agree with her?
Yes, I agree.
Michael, where do you stand on this?
Yes, it's today because we are writing what is happening now to the specialist. So it should be today's visit.
Excuse me, I have another alternative.
Wait,
Since
let's land, Bjorn. Okay. Wait, let's land. Michael, you said it's today, I agree. But
yes, today's visit should be in paragraph 2.
Come again.
Today's visit should be in paragraph 2.
Why?
Because we are writing the current situation of the patient to the specialist before the previous visit.
Is it because he's a specialist? That's why we are writing today's visit.
No, because it's emergency. It's emergency.
That's
so
what
we are writing.
It's okay. That's what I wanted to get from you. Because this case is an emergency. Because this case is an emergency, we are going to start from today's event, whatever happened today. Because it was from what happened today that you thought, oh, this patient will require urgent admission or be sent to emergency or whatever. So we are going to discuss what happened today first, because what happened yesterday and 2 days ago or weeks ago, they become less relevant to the reader. So what happened today will be more relevant to the reader. What you saw, what happened that made you think, oh, this patient will require an admission. So you start from today's visit, okay? So that means today's visit will be our second paragraph. Okay. The next thing now is to write the second paragraph, right? Do we want to attempt? Hello guys, do we want to attempt? All right, quickly write and let me type it. So this the information you have to use for your second paragraph. That's today's visit. I will give you guys a minute. So let's see what you guys have written for the second paragraph. Let's start with Biodo's this thing. Biodo said on today's home visit to Miss Jones, she was noticed not to be happy and having shortness of breath. She complained of chest pain, generalized body weakness, and palpitations despite taking her routine medications regularly. She was febrile, respiration was 32, heart rate 120, and an assessment of question mark relapse pericarditis was made. What do you guys have to say about this? Biodun, what do you have? I say Biodun. Patricia, what do you have to say? Firstly, let's not waste time. First, okay, go on. Yes. No need even using those features. And anyway, let's start from the beginning of your of this paragraph. You said on today's home visit, immediately after the introduction. Let's go back to your introduction. Introduction said, I'm writing to Miss Jones, who was diagnosed with viral pericarditis, and she may be having a relapse. She would require your urgent assessment and management. Then your paragraph 2, you now say, on today's visit to Miss Jones, she was noticed not to be happy and having shortness of breath. Now, if you say on today's home visit to Miss Jones, have you done any visits before? Have you seen this woman before? That you're not saying on today's home visit to Miss Jones? Because you've actually seen this patient before, but the person you are writing to is not even aware that you've seen this patient before. So you saying on today's home visit to Miss Jones appears as if there was a time you saw her before or something. That's what this expression is saying. So you've not actually let this reader know that you've seen this patient before. You now say she was noticed not to be happy. Instead of using this negative not to be happy, why not say she was noticed to be unhappy and having shortness of breath? She complained of chest pain, generalized body weakness, and palpitations despite taking her routine medications regularly. She was febrile, respiration was 32, heart rate 120, and an assessment of relapsed pericarditis was made. Remember, in your introduction, you've already talked about this assessment. So is there any need repeating it again in this paragraph too? So I think this should just stop. This paragraph should just stop. Here. Despite taking her medication regularly, before you proceed to the no, this paragraph should stop. Should stop here. Mm. You've already mentioned that diagnosis, so no need repeating it again in this paragraph again. So let's go to the next person's second paragraph. Okay, on today's home visit. Okay, if I want to start this paragraph now, if they want to actually write this paragraph, because you can't just start all the way, because you're writing events that happened today, you just come from the sky and start telling the person, assuming that the person is already aware of what you've done before. It doesn't work that way. So if I want to start, I will say something like this. Ms. Jones was visited at home as a follow-up visit after she was successfully treated for viral pericarditis. However, she was unhappy as she was still experiencing chest pain, shortness of breath, and palpitations. Did you see how I configured that? Or you want me to type it? I will type it later. Let's review other person's own. Let's review other person's write-up. So this should be for Patricia, I guess. So Patricia said during today's visit, patient was observed to be unhappy, short of breath, and complained of generalized body weakness and palpitation despite taking her routine medications regularly. On examination, she was pyretic, tachypneic, and tachycardic. Hence, an assessment of queried relapsed pericarditis was made. Now, the same thing again. This place should not be there because you've written this already, so no need. Yes, repeating it here again. Because if I go back to your let me read your introduction for you to see how it sounds. Thank you for accepting to see Miss Jones, who urgently needs your assessment and management. She was diagnosed with pericarditis and seems to be having a relapse. Are you now advancing during today's visit. Do you understand? So there is no need you saying this, repeating this again here. So you can actually expunge this here. So, and it will now stop here. But this you're doing today's visit, it's actually sounding as if actually there have been like a kind of consultation or visitations in the past before. So you know this is your first paragraph. If this were to be your last paragraph now, maybe after 2, 3, 4 paragraphs, this is coming this way. It will sound very, the linking, the cohesion will be very okay. But here now the cohesion is not clear because you've not actually made mention of previous visits or things before that you did that you're not starting with during today's visit. I don't know if you get, Patricia. It's okay. So let's go to Michael's paragraph. If you still say on a home visit to Miss Jones today, you still have to explain what actually had transpired that you are visiting Miss Jones today. You saw how I said I said Miss Jones, I even wrote it down. I said Miss Jones was seen unhappy. Okay, no, I said Miss Jones was visited at home as a follow-up visit after she was successfully treated for viral pericarditis. So you can now see it's clear why you went to see this woman at home. Do you understand? Okay. Yeah. So Michael said today Miss Jones reported chest pain, shortness of breath, and palpitation despite taking her routine medication constantly. On examination, she was moody, and her vitals, temperature, and heart rate were all elevated. In view of the above, a presumptive diagnosis of pericarditis was made. Even this, in view of the above, most time we use this in our concluding paragraph. It's even out of place. So, first of all, this one will not even still be there. Made the same mistake again for all of us. You said you have made the diagnosis clear in the introduction. No, there's no need repeating it. Let's read Amos's own. On home visit today, Miss Jones made a complaint of why not just say made a complaint of generalized body weakness and saying made a complaint of made a complaint of generalized body weakness. But it's not if you say a complaint and you are listing a lot of complaints here. So you should say made complaints of generalized body weakness, shortness of breath, palpitation, fainting spell, as well as sharp and pleuritic chest pain, which started about 2 hours ago. If you say 2 hours ago, that will not be right because at the time you are writing this thing and the person is receiving it, 2 hours would have exceeded. You will say of 2 hours duration. That will be the right thing to write. She seemed not to be happy. You were reporting, you should use past tense. She seemed not to be happy. Why not say she seemed to be unhappy with her condition despite taking her routine medications. However, she was noticed to be febrile with temperature of this respiration. Okay, I think only almost she didn't repeat this again. So these are our right mind. Miss Jones was visited at home as a follow-up visit after she was successfully treated for viral pericarditis. However, she was unhappy as she was still experiencing chest pain, shortness of breath, and palpitations. She was observed to be pyretic, tachycardic, and tachypneic. Full stop. So no need repeating the diagnosis that I've already mentioned in paragraph in the introduction. Patricia's paragraph 3. She said, on 6/9/20, Mrs. Jones presented with sharp pleuritic chest pain, shortness of breath, and generalized body weakness, and fainting spells. Okay, she actually said comma here. Shortness of breath, comma, generalized body weakness and fainting spells. On assessment, there should be comma. On assessment, she was hypertensive, pyretic, tachypneic, and tachycardic. In addition, comma, full blood count, CPR, full blood examination, CRP, ESR, were elevated. Her echo also revealed an inflamed pericardium, and throat swab taken was positive for influenza type B. She was rehydrated and analgesic given. Symptoms subsided afterwards and was discharged home. That's a nice write-up, but there are a lot of repetitions. Go back to your previous paragraph, your paragraph 2. That is Patricia's paragraph 2. Okay. You said during her the patient observed to be unhappy, shortness of breath, complain of generalized body weakness and palpitation despite taking her medications. And in this paragraph again, we are repeating all those symptoms that the patient complained initially. Do you understand? So you can just say similar patient. Do you get my point? So no need repeating all these symptoms again. Here you say in addition, full blood examination. Remember in the case note said, let's go back to that case note again. Why it might stop misbehaving now? From the case notes, look at what they said. Full blood examination, they put colon, which include this ESR, CRP, WCC. Do you understand? So full blood examination include all these things that they've listed: erythrocyte sedimentation rate, C-reactive protein, white cell counts. You get, Patricia? So not happening to. So that's the mistake that she made, that she was rehydrated and then say symptoms subsided afterwards. Every other thing is actually okay. So the error here, just the repetition of symptoms that you've already mentioned before, which will make your word count to increase more, and it will not be unnecessary information. Do you understand? Because you've given this information before. Now look at how I wrote mine. I said initially on this date, Miss Jones was admitted following similar symptoms, and her full blood examination, which included ESR, CRP, and WCC, were all elevated, and an echocardiogram done with throat swab confirmed the diagnosis, referring to the diagnosis that I already established in the introduction. Thereafter, she was resuscitated and diclofenac was prescribed. 2 days after, Miss Jones should be apostrophe. Miss Jones' clinical condition improved and she was discharged on ibuprofen. Now, there's actually a mistake in this my paragraph. I said all this confirmed the diagnosis. Remember, the diagnosis we are working with is relapse. Yeah, it's relapse pericarditis. So this should not be referring to that. So we can say with throat swab confirm the diagnosis of type B viral pericarditis. So we can use this one now, because in our introduction is the relapse of this pericarditis that we are suspecting. So if we say the diagnosis, we are not referring to the right thing. So confirm the diagnosis of type P viral disease. Thereafter, she was resuscitated. That's the normal saline that she was given, and diclofenac was prescribed. 2 days after, Miss Jones' clinical condition improved and she was discharged on ibuprofen. I wanted to put this one in another paragraph, but I look at it, it's just too short, so I can actually add it with this paragraph, okay? Making it our paragraph 3. Now, our paragraph 4. Our paragraph 4, what should not be on our paragraph 4? What are we going to include in our paragraph 4? That should not be the background information, which will include the medical history and the medication. We didn't get anything from the family history, and we didn't get anything from the social history. So we are left with only medical history and background information. So I think that is actually very simple. So what you are going to do now, I will end this meeting now. So let's any person that writes his or her own first can just write it down. I'll quickly write and create another so that we just end this meeting, okay? So let's see what you have in your paragraph 4. Michael, your paragraph 4, you said, regarding Mrs. Jones' medical history, she has been suffering. Okay. Oh, okay. All right, so sorry about that. I didn't know. So, Michael posted this regarding Miss Jones' medical history. She has been suffering from hypertension and type 2 diabetes, for which she has been taking Ramipril. Ramipril should be in small letter. Ramipril, amlodipine, and metformin. Do you have any question or any criticism, anything you want to say about this paragraph 4? All right, let me correct one thing. There are some mistakes that we'll make. There are some conditions that patients suffer from, and there are some conditions that patients do not suffer from. Even from the case notes, this patient's hypertension is even well managed. The diabetes is also well managed. So this patient is not suffering from hypertension. So when you have something like hypertension, diabetes, I will advise you refrain from using that word, suffering from hypertension and diabetes. If the patient has something like asthma, somebody that is asthmatic is actually suffering. Somebody that is depressed is actually suffering. Somebody that has migraine is actually suffering. So there are conditions that the sickle cell patient is actually suffering. Okay, but most persons diagnosed with hypertension and diabetes, they are not suffering because these conditions are well controlled and well managed. All right. Are you with me? Yes. So we remove this suffering from. You can use it for all those conditions that I mentioned, like migraine, asthma, sickle cell, epilepsy. These are the people suffering. Depression, those ones are suffering. But these patients, hypertension and diabetes, patient is not. It's not that this. It's not just right. Don't use it. Remove it. Okay. So let's go to your paragraph 5. I believe Miss Jones will benefit. When you are making a request, you use the polite form. So you say would, because you are making a request from this person. So you should be polite. I believe Miss Jones would benefit from your expert evaluation and treatment. Please update me on her condition. So that's okay. So let's see my paragraph 4. My paragraph 4, I said, okay, I've actually read that before. Please note that Ms. Jones is a known hypertensive and diabetic. She's currently on Ramipril, should be small letter. Currently on Ramipril, amlodipine, and metformin. In view of the above, I believe Ms. Jones would benefit from your urgent, because I'm still restating the purpose again. So don't want to say urgent, I will say immediate benefit, because I've used urgent before. I can say immediate. In view of the above, I believe Ms. Jones will benefit from your immediate evaluation and further treatment, hence the referral. Kindly update me on his progress. So your last distance will now be, please contact me if you have any query. So what you are going to do, let's select those ones that we've edited that we think that they are okay, and put everything together so that we can post it in the group for you people to compare with your case notes and all. I don't know if you have any questions, because we want to end this webinar now. Mm-hmm. No, for when you use small, when you have to use small letter, when the name of the drug is when it's a generic name. No, it's a generic name. If it's a brand name, you use capital letter. So Ramipril is the generic name of this drug. Amlodipine is a generic name of this drug. Metformin is a generic name of this drug. If the drugs, hmm? If, in other words, if these drugs were written with brand names, for example, let's say something like augmentin. You know the generic name of augmentin is amoxiclav and clavulanic acid. It's amoxicillin and clavulanic acid. That's the generic name, but the brand name is augmentin. Another example is Fortwin. What's the generic name of Fortwin? Yes, pentazocine is the generic name, so use small letter. But Fortwin is the brand name. You use capital letters. So that's the reason for this small letter. Okay, so I want to do something. I want to copy create another distance so that I can copy everything. So let's go back to the this thing is always affecting my okay. All right, let's read our letter from the beginning to the end. Thank you for accepting to see Miss Jones, who urgently needs your assessment and management. She was diagnosed of pericarditis and seems to be having a relapse. Miss Jones was visited. Miss Jones Miss Jones was visited at home today as a follow-up visit after she was successfully treated for viral pericarditis. However, she was unhappy as she was still experiencing chest pain, shortness of breath, and palpitations. This should be she. She was observed to be pyretic, tachycardic, and tachypneic. Initially on this. So I'm using is initially to link this paragraph to this one. Initially on this, and also to establish when the whole problem started. Initially on this, Ms. Jones was admitted following similar symptoms, and her full blood examination, which included ESR, CRP, and WCC, were all elevated. An echocardiogram done with throat swab confirmed the diagnosis of type B viral pericarditis. Thereafter, she was resuscitated and diclofenac was prescribed. 2 days after, Ms. Jones' clinical condition improved and she was discharged on ibuprofen. Please note that Ms. Jones is a known hypertensive and diabetic. She is currently on Ramipril, amlodipine, and metformin. In view of the above, I believe Ms. Jones will benefit from your immediate evaluation and further treatment, hence the referral. Kindly update me on her progress. Please contact me if you have any queries. So that's the full write-up. What I will do is to copy this and post it in our Telegram group so that you can still go through that later. And secondly, I will edit. Okay, let me see. Yes, the computer can even count it for us. Let's see. So your counting should start from introduction to the concluding paragraph. So let me highlight from concluding paragraph to introduction. So your letter is 477. Hello. 77 words. Yes, which is very okay. So the range is 180 to 200. That doesn't mean if your letter is like 170, 160 something to 180, that is not okay. If your letter also exceeds 200, like 2 to 210, but when it's exceeding 220s, or maybe most likely you are adding a lot of irrelevant details. So I think that's all we can take.
Okay, so it can be 167.
Yeah, yes, as long as you've added all the relevant information needed. Because there are some letters that they will pack a lot of irrelevant things, like the one we reviewed yesterday, the one I reviewed yesterday with the doctors. They packed a lot of irrelevant things in that letter. So that letter didn't get up to 170, but we were able to get the appropriate, the necessary detail that we are supposed to add, and left out those that we are not supposed to add. Okay, so don't be worried if your letter is less than 170. So I think this is all we can take today. Yeah, this is what we can take today. I want to. All right. Bye. Yeah, yeah. So till tomorrow we'll continue with our lectures. Yeah. Bye bye. Yeah. Please kindly subscribe to my channel, and if you want to get to me, you can get to me with these details. All right. Bye.